everyone, Ron Ned. Welcome back. Another episode of East Glendale Advice Givers, the podcast where each week we search for the best solutions and answers for you from Glendale's brightest. Today I'm going to talk with Dr. Yoshi Rahm about a topic that many people are curious about but few really understand. That's stem cell therapy. Dr. Yoshi became a doctor because of what he saw his brother go through, and he'll tell that story in this interview. He focuses more on alternative and natural approaches because that's what his patients have demanded from the day he opened his doors. Then when his mother-in-law came down with a severe health condition which typically results in death in 2 to 3 years, he immediately sought out any treatment that could possibly help. He investigated everything out there, and then he found out about stem cell therapy, and after his investigation, he decided to give it a try. The results for his mother-in-law were better than any other option had even promised. So now, when it's appropriate, he'll offer it to patients who can benefit from it. Join me for a truly enlightening conversation with Dr. Yoshi and gain a better understanding about stem cell therapy. Good morning, Dr. Yoshi.
Good morning.
Pleasure to be here. I'm looking forward to this, and I think a lot of the people who are interested in this topic are looking forward to hearing what you have to say.
Yeah, great. I just want to give a little shout out to everyone who's going to be listening to this. And my whole purpose is to educate and hopefully help someone.
Excellent. So let's start off with your motivation for getting into the healthcare field. What was it that was the driving force behind you going in this direction rather than becoming an engineer or a steel worker or an actor?
Actor sounds fun. No, I definitely have a huge passion just for healing people, helping people heal themselves, I should say. And it comes from the fact that my younger brother, who is 3 years younger than me, he actually had spinal meningitis when he was an infant. And he ended up actually becoming very, very sick. He was in a coma for about a week, and he ended up having approximately 20% of his brain removed.
For people who don't know, spinal meningitis is an infection of?
The brain and or spinal cord, but in his case, it was mainly the brain.
Okay.
And he came out of the coma, and he had to relearn everything that he had learned. He was an infant, so he did it pretty well, but he also had seizures for the rest of his life. And he ended up actually passing away a couple of years ago, but he was able to live a quite fruitful life. Now, backing up to that, though, to his younger years, the surgeons had wanted him to have a shunt placed, and basically that drained the CSF or cerebral spinal fluid that's in the brain, and place a shunt from his brain down into his abdomen to drain the fluid, because this fluid was backing up, which can cause very serious conditions, including death. And the problem is when you do that in a kid, they're going to need it every time they have a growth spurt. So over the course of the next couple decades, that would have required a lot of surgeries, and coming back from a brain surgery is hard. And so my parents were they were wonderful in the fact that they sought out other opinions, and they ended up taking him to a DO, or a doctor of osteopathy, who was able to do some manual therapy and actually drain that CSF fluid from his brain in a totally natural way. And so he would see my brother for once a week for a long time, but they were able to get away with not having to perform any surgeries at all. So I grew up kind of understanding that there were these other alternatives to conventional Western allopathic medicine, which we obviously need. It saved my brother's life. He needed that brain surgery. They needed to get rid of that infection, and there was probably no alternative type of therapy that was going to save his life at that point in time. However, after that acute or sudden sickly situation, going the alternative route really served him. So it was a great marriage between the conventional Western medicine and alternative modalities. And so I grew up wanting to pursue health and choosing to go to a DO school and becoming a doctor of osteopathy was what I wanted to do. I actually did not apply to MDA schools. And for those of you who don't know, because especially a lot of people in California don't know, there are two types of physicians in the US, and they're pretty similar. with a difference. MDs, which most people know about.
Mm-hmm.
And then there's DOs who get the same exact training that MDs get, but then they also get an extra 200 hours in manual therapy. So we have a little bit better understanding of, I would say, the musculoskeletal system and nervous system, as well as manual modalities that might be able to alleviate some physical symptoms.
Right. So when you say manual, you mean spinal manipulation type
Correct.
and
Correct.
other joints.
Yeah.
So similar to what my degree is, which is a DC degree, Doctor of Chiropractic, except we don't get the surgical and the pharmaceutical training that's obtained in medical school or osteopathic schools.
Correct.
So you're kind of in between medical and chiropractic because you're able to do what medical doctors do, and you're able to do a similar thing to what chiropractors do.
Correct.
Okay. So that clarifies that. So that explains how you went in this direction was because of what your brother went through and what you saw as far as the help he received from the osteopath that helped him out.
Exactly.
Okay. Now, you opened your practice how long ago?
In 2011. Currently, we practice integrative medicine or family physician. So there's myself as well as Dr. Ann Kuo, and we are both family physicians. So we see everyone from young people, newborns, to the elderly, and for all kinds of conditions. But we do practice it with an integrative aspect. And so we're able to draw upon other healing modalities from chiropractors. So we won't always perform these other modalities necessarily, but we have a much better understanding than most MDs do. And so we know when to refer appropriately, i.e. to a massage therapist, to a craniosacral therapist, to a chiropractor, to an acupuncture, et cetera, et cetera. And we practice with the functional medicine approach, which is really trying to find the root cause for diseases or medical conditions that come up, right? I'll usually give some example, like you don't have arthritis because you have a lack of Tylenol floating around in your system. Right. There's a reason you have that arthritis. And so we try to figure that out.
That's a good point, because I can't remember whether it was my brother or someone else always used to say is that you don't get headaches because of an aspirin deficiency.
Exactly.
So that was very good. And a lot of this came about because when you opened your practice in 2011, you were mentioning to me that you found out there was a lot of demand for a holistic approach from the people that were coming in, correct?
Yes. I put my website together, and I put it because I was interested in a more alternative or integrative approach or functional medicine approach, but I put my website together really saying that. And then it turned out 9 out of 10 people who were coming into me in the beginning of my practice were really coming to me for that alternative or holistic viewpoint. And so I said to myself real quickly, I better get a lot of extra training. And I spent that first year or two in practice taking tons of additional courses. So I really, went through medical school, went through internship, residency, and then I went through a crap ton of other certifications and just to gain more knowledge about how the body really works. And I would say, honestly, I probably use about 5% of what I learned in medical school and residency. And most of how I practice medicine is really what I've gained and what I've learned since I graduated as a resident.
That's great. And you work with Dr. Moravati to some extent?
Yeah, Dr. Moravati, he's a wonderful chiropractor and a wonderful person, wonderful human being as well. And I just love his philosophy. He's close by, offices very close to each other, about a block or two away from each other. And yeah, definitely refer to him.
Yes, I found out about you through Dr. Moravati when I interviewed him on the podcast. And it seems that you both have a similar view of how people should be treated, which is nice because it gives you someone to work with and somebody close by that you can talk to that looks at things the same way. Whereas a lot of times your peers almost will either shun you or not quite agree with your approach or feel that you should do things just the standard conventional way. And that doesn't help at all.
Yeah. And it's interesting because anyone going into the healthcare field typically really is there because they want to help people. But we also only know what we know, and we don't know what we don't know. Doctors typically, if they don't know something, or understand a recommendation that another healthcare provider suggested to a patient, the first response is, well, don't do that, right? Because we want to cover our butts.
Right.
But that doesn't serve the patient. Ultimately, it's always about the people walking through this door. That's who we want to serve. And sometimes I can't serve that person best. Sometimes Dr. Quo can't serve that person best. Sometimes that might be more for a Dr. Moravati, or vice versa, or for some other healthcare practitioner.
Absolutely. Now, what are the types of services and type of care that you've added to your practice to meet that demand that you found as far as people wanting more holistic type care?
Kind of a general principle of how we practice medicine here tends to be, well, I'll preface it. Sometimes we get people who just want to come in and get their drug, their prescription, and kind of a pros versus cons conversation. That's fine if that's what the person is looking for. Most people, though, again, are wanting some kind of alternative approach. And so generally, we're going to recommend more lifestyle modifications first. So, working with movement and nutrition, of course, is a huge piece of that. And then we're going to move on to using more natural remedies, minerals, vitamins, maybe get into herbs, and then generally move more on to the allopathic or conventional medicinal modalities. So during the course since 2011, we've added in IV nutrition as a possible modality to use at times. We have electromagnetic field therapy. We do something called prolozone therapy, which is where we actually inject into joints or soft tissues. Ozone, homeopathic remedies, some minerals, vitamins can be a great modality to help aches and pains, oftentimes in conjunction with manual therapies. Sometimes not needed. Really depends on the person. One of the more interesting things that we've added in recently in the last year is stem cell therapy.
And we're going to get into detail on that, but I want to go back to the first one, which was, first one you said was nutritional.
Nutritional IV therapy.
Is that like large doses of vitamin C? And I think there's another one called Myers cocktail.
Yeah.
So those are the type of things that you do?
Yes. And if someone comes into us and they have a severe gut problem where they're not able to absorb the nutrients that they put in, right? Because what we put into our hatch, i.e. our mouth, is really important. Good nutrition is important. But some people are in an unfortunate circumstance where they might not be able to actually absorb that nutrition. And so that would be one example where doing some IV nutritional therapies that might include high-dose IV vitamin C or minerals or vitamins added in, or glutathione, which is one of the body's main, it's really the body's main antioxidant, actually. So it can be wonderful in that regard. Maybe for someone suffering from chronic fatigue syndrome, chronic Lyme disease. There's a lot of conditions, a lot of autoimmune conditions especially, can really benefit from IV nutrition.
Even something like pneumonia. I mean, you don't want to mess around with pneumonia, but I know of people who've gone in and have gotten the IV vitamin C that just help them come out of it very quickly.
Yeah, and that goes whether you end up using an antibiotic or not. The IV nutritional therapies, they can help you just recover a heck of a lot faster, if not combat that initial infection alone, potentially.
Yeah, so I know doctors that use that, and I know how valid of a therapy that is. A lot of people don't realize that they can get something like that, and it's very simple to do, and it's not hugely expensive either.
It's cost effective.
Right.
That's what you want. You always want cost effective.
Absolutely. So now you'd mentioned you'd gotten into stem cell therapy about a year ago. So how did you get into that? Because you gave the explanation of your brother's story and how that influenced your direction in going into a natural approach, an osteopathic approach. What caused you to look into stem cell therapy?
Yeah, it's an interesting story. I am a physician, so I know a decent amount about stem cells, but I honestly did not know that much about it a little over a year ago. That's when my mother-in-law, whom I totally adore, mostly because she takes care of our kids. Just kidding. I actually really adore her. And she was diagnosed with idiopathic pulmonary fibrosis, or IPF for short. And that is basically a slow scarring of the lung tissue, typically over about a 3 to 5 year period. And then you suffocate to death, or you get a lung transplant, which are, you want to avoid organ transplants as much as possible.
You want to avoid surgeries as much as possible. Even when you were mentioning about your brother, and this is a philosophical thing for me, but it's also a realistic thing. From when my mother was in the hospital before she passed away, the risk of infection or doctor error or problems coming about from being in the hospital or having surgery are very high. So it's not just an opinion that I don't like surgeries. It's realistic that those things can cause problems. So you're correct. If there's an alternative way of dealing with something that doesn't require hospitalization or surgery, it reduces a lot of risk.
Oh, absolutely. It's interesting because there's actually documented over 100,000 people die every year in the U.S. due to doctor error or medication error, prescription medication error, or nursing error. 100,000 people is a lot of people in the U.S. That's approximately 2,000 people every week.
Right.
I mean, so yes, our allopathic medicine has this potential to save lives, absolutely. But there's also a real potential downside. And so it's always a risk versus benefit. So yeah, avoid surgeries whenever possible.
Definitely. So you were saying that was one of the things that you were looking at as a way of helping your mother-in-law, because the idea of a lung transplant down the road, first of all, you don't know if she would be able to find them in time, a set of lungs. And the other thing is the risk involved. So continue on with what that caused you to do as far as your study and your approach.
Yeah, I should mention that probably around 2015, 2016, there actually came out 2 heavy-duty medications, cost approximately $8,000 a month.
Wow.
For IPF, and both of them are shown to likely prolong that typical 3 to 5 year death rate, would draw it out another couple of years. So definitely a medication that prolonged life, which is great. I mean, when you got nothing else, that's wonderful. Also, just of note though, it's $8,000 a month, right? And not benign medications. So they come with their list of potential side effects as well. So what I did was I basically shut myself in my office for a week and did all kinds of research, just looking at what we could do for IPF. And I was open to anything. I would have put her in drug trials. I would have sent her to some other doctors. I would have done hocus pocus, voodoo medicine. At the end of the day, when you have a loved one and you just want them to live, you'll pretty much do anything within reason. And it became very clear to me that I had to consider stem cell therapy for her, that it was probably going to offer her the best chances of living a longer life or more robust life. So we gave her we actually did intravenous stem cells, umbilical cord stem cells. And that was around the middle of August of 2017. And within 36 hours, she actually woke up. She said she could breathe better than she had been able to breathe in about the prior 6 months. Her O2 saturations actually improved. And then she kind of hit a baseline. So it did not completely reverse her situation. But we also had the previous CAT scan before the stem cell therapy, and then a CAT scan around the very end, I think it was sometime in December of 2017, that showed a complete stabilization of her lungs. So that was interesting because it basically showed that the scarring had not progressed.
Right.
Which was a huge win. So yeah, it's not like she didn't grow new lungs, right? Which would have been lovely if that had happened, but also not realistic. But we had totally halted the progression, which is incredible. Now,
and that's better than the drugs that had come out, because those only slowed the progression. They didn't stop it.
Correct.
And you weren't spending $8,000 or $9,000 a month to do that.
Correct. Now, I should mention, I want to be totally honest. She ended up starting one of the medications in January of 2018. Part of our reasoning was, well, give it a try. see how you respond. If you can tolerate it, maybe you do that along with the stem cell therapy. And, we just got a report in June. So just about a full year after initial diagnosis, again, lungs totally stable. Now we're continuing to do stem cells every, 3 to 4 or 5 months.
Mm-hmm.
So she's received a few rounds of it, but it's just incredible. Now she also had a brother who actually died of IPF.
Oh, wow.
And he, within 2 years of diagnosis, I might get my years a little off, but I think it was within 2 years of diagnosis, he had a transplant. And then a year later, he died from the transplant, from complications of the lung transplant. It was either that or else it was within 1 year of diagnosis, he had the transplant, and then 1 year later, he died. So he was looking at from diagnosis to death, either 2 or 3 years.
Wow.
Again, I apologize for not knowing the specifics on that. But here, my mother-in-law is, and it's now a year after diagnosis, and she's completely stabilized. And so it was really just after those first few weeks or few months where we saw that she wasn't getting worse. I said, this is something I gotta learn more about and have as an option for people who it makes sense.
Mm-hmm. Absolutely. All right. So then what is a stem cell? And why is it viewed as having so much potential as an alternative treatment as opposed to the conventional treatments?
Yeah. First of all, there is a lot of stem cell therapy research going on nowadays.
Mm-hmm.
And it's amazing. The world is going to explode in terms of stem cell therapy applications over the coming few years. And I would anticipate that within 5 to 10 years, insurance probably will cover it because it does have such profound potential to heal. Mm-hmm. I will say I've said this a few times to various people, but it's as close to a silver bullet as I've seen in medicine, which is a very strong statement. I don't say that statement lightly, but I've never seen anything else with such a truly healing potential. What a stem cell is, when the sperm and the egg come together, they meet, they basically form one cell, and then those split. And those first few cells that double and then double and then double, so 2 cells, 4 cells, 8 cells, 16 cells, those are the embryonic stem cells. And those cells can literally turn into anything in the body, right? Which makes sense. Mm-hmm. Because we start out as those cells, and I'm sitting here in front of you and vice versa. And we're this amazing, intricate human being. And so embryonic stem cells can literally turn into any cell in the body. By the time we're 9 months old, or the first day we're born, we come out. And we still have some stem cells that are floating around in our umbilical cord and even amniotic sac, but mostly are in umbilical cord. And so what we use when we do umbilical cord stem cell therapy is we're harvesting those stem cells from the umbilical cord that would have been thrown away in the trash. And
so these are, because that was a controversial thing about stem cells several years ago. People were concerned about where the umbilical stem cells were coming from. So these are ones where the children are born, and they're not born by cesarean section. They're born naturally.
They actually are born by C-section.
Oh, they are.
So they're healthy moms and healthy babies who have been screened for all the major communicable diseases and are negative for all of those. And then they're scheduled C-sections. So there's no emergency C-sections. They're scheduled C-sections from healthy moms, healthy babies.
Right.
They're not embryonic stem cells. So we're not, that's a big ethical thing as well. Mm-hmm. People are worried about, are we killing babies or abortions? This is not embryonic stem cell therapy that we do. You can't do that in the US. It's illegal. And so it's really this amazing product that would have been thrown in the trash, and now we're able to use it. And the stem cells that are present in the umbilical cord, those are also the mesenchymal stem cells specifically. Those are able to turn into almost any tissue in the body, especially musculoskeletal tissue. So
what's
bones,
mesenchymal?
Cartilage, muscles. Mesenchymal, all cells are covered with proteins on the surface of the cell body, of the cell wall. And we give names to each one of these proteins. And the mesenchymal stem cell is just the name that we've given to the cells with this particular protein on the surface. And again, those are the workhorses. So these specific cells with these specific proteins on the cell wall, those are the ones that can turn into the cartilage, that can turn into the muscle, that can turn into bone. Now, I'm going to keep going with that. There's a little bit of a misconception that the stem cells that we're injecting are doing all of the healing. They are not doing all of the healing because it's a very small amount of stem cells that we actually put into the body. If you put it into the joint, for instance, and hope that it regenerates cartilage, well, those stem cells, they can turn into new cartilage cells. However, it's also with all of the other healing growth factors, all of the other healing molecules that come along with those stem cells. Those are what are able to really cause your own body to regenerate itself. So, which is different than injecting these cells that are just going to turn into new cartilage in this example. It's really more that we're injecting these cells into the diseased area, and it's causing our own body to say, oh, we need to turn on this cartilage making ability again.
Right.
So it's a beautiful system.
So it's a complex that's going, and it's like we discussed the other day about vitamin C. Vitamin C is not ascorbic acid. Vitamin C is ascorbic acid with rutin and riboflavins and all the other things that go along with it that you find in their naturally occurring environment, things like oranges or whatever, is it has this entire complex, and that's what vitamin C is. And some people over the years have refined it down to its ascorbic acid, which it isn't. So the same thing with the stem cells, from what you're saying, is it's not just the stem cells, it's the stem cells and various other factors that go with it that cause the type of reactions that are so positive.
Exactly. It's a beautiful example. And we had mentioned, I think I had mentioned the other day to you about it being a symphony, right? And I love the orange analogy that you just gave with the vitamin C. And I love the idea of a symphony, right? You don't just need one player in a symphony. You need multiple players to create that beautiful harmony and beautiful sound. And that's what the stem cell therapy really has the potential to do. These are natural human cells, and we're putting it into the diseased area very specifically. And it's that amazing symphony that we're literally injecting into the area of the body that needs it most.
Excellent. So we're talking about the umbilical stem cells, but there are other types of stem cells too that can be used in therapy.
Yeah.
What are those?
Yeah, great question. So I think what most stem cell clinics in the US are currently using are adipose, where they get it from their fat. It's like a little mini liposuction that they do. Or they get it from your bone marrow. So they typically go into your hip bone, your pelvic bones, and pull out some bone marrow and spin it down and aspirate or suck off that little layer of stem cells. And then there's also a third one that I'm going to throw out there, which is PRP, or platelet-rich plasma, where you basically just go in and get a blood draw, and then you spin it down. And we actually do PRP in our office as well. There's very few stem cells that you get from PRP. It's really more of just the growth factors that you're able to collect. So you're able to get this amount of blood, spin it down, suck off just the growth factors, and then re-inject it into, again, whatever area of the body you're hoping for regrowth.
Right.
I actually just had Dr. Quo do it for my head, actually. So I'm hoping we'll see in 6 months or 3 months if my little balding spot on my head gets some new hair.
I'll be checking back with you on that.
Yeah, I think a lot of guys will be.
We may need to do another podcast episode if that works well.
Absolutely. So there's the PRP, the fat cells or adipose, and then the bone marrow. Now, these are good therapies. They're therapies that work. You definitely get stem cells out of those. Fat cells, according to the literature over the past couple of years, looks like the fat cells are probably a little bit better than the bone marrow stem cells. And so a lot of people are doing the adipose or fat tissue stem cell therapy nowadays. The issue is that, and I'm going to go back to using my mother-in-law as an example, she was 67. Yeah, now she's 68. So she was 67 at the time. If I had sent her to some doctor to do adipose stem cell therapy from her own fat, the issue is that those stem cells are 60 or were 67 years old. And as we age, not only does the stem cells quantity in our body diminish, the quality of whatever stem cells are still there gets worse. So her stem cells are 67 years old. What do you think is going to perform better? A 9-month-old from a newborn versus a 67-year-old? And it's pretty clear in the literature as well. And so I'm a much bigger proponent of using the umbilical stem cell cord. And ultimately, it came down to I wanted to give my mother-in-law the very best option. It would have been so much easier for me to send her to some other doctor who had been doing this for a long time. I would have loved to have done that because it takes the burden off of me. However, again, it was very clear that she was probably going to have better chances of receiving umbilical stem cells compared to her own.
Absolutely. And for the adipose stem cells, do you go after like surface layer fat, or do you go through the fat that surrounds the organs? Was there one of those that's better?
No, it's literally, they get it from the belly, typically, or it's like a little mini liposuction. It truly is. Now, they usually don't take out enough for you to notice on the downside.
But it's a good way for me to justify not exercising as much as I should, because I'm just keeping a store in case I need it.
Just in case.
That's right. All right. So when you're doing stem cell therapy, how do you determine how much is needed, how often it's done, and where it needs to be injected? Is there specifics on that? Because I know this is a developing technology in therapy, but I would assume that those things would be pretty well set at this point.
Yeah, like you said, it is a developing field for sure. Most stem cell therapy in the U.S. is done for musculoskeletal issues. So knee cartilage that is degraded or meniscus that is torn.
Meniscus is the little spongy thing in the knee.
Correct. Yeah. That gives us our padding, or in shoulders or hips as well. And that's where I don't know the exact percentage on this, but I'm guessing probably like 90% of stem cell therapy is done for a musculoskeletal condition like that. And then you run into the other issues that it's done for, which could range into almost any other situation, potentially. My mother-in-law, it was for her IPF. Now, when you inject it into a joint or a soft tissue, it's going to act on that area locally. So it's a great modality because we're going to inject it into a knee, for example, and it's really going to stay there and do the healing there. When you inject it intravenously, like we did for my mother-in-law, it actually will literally go into our blood system, which supplies our entire body. Now, the first small blood vessels after an intravenous injection happen to be in the lungs. So it is used intravenously. It's used more for lung conditions than for any other condition. So it kind of worked to our favor. And that's why I wanted to do it for her, try it on her at least. But then after a few days of the stem cells getting lodged in the lungs, they do kind of free themselves from the lungs, and then they actually end up going all over the body. One thing I should also mention is that when you do it intravenously, outside of that first pass effect where they get lodged in the lungs, our body sends out little SOS signals when we have a diseased area. So in a gut situation, for example, where someone might be suffering from ulcerative colitis or Crohn's, and I mention this because there's definitely some animal studies that show this, the stem cells will literally home into that area. Because of those little SOS signals that our body is sending out from the gut, the stem cells know it's this amazing symphony, and they know to go there. So they're not going to the pinky finger because they're not needed at the pinky finger. They're going to the gut because that's where they're called to go into action.
Excellent. So they know that there's something going on because it's like, hey, over here.
Yeah.
So they go over and visit that area.
Exactly. And you asked about the quantity, and that's where a lot of doctors have a lot of anecdotal experience. And so it really depends on how severe is the disease that we're going after. That's really it. And even if that's just a deterioration in the knee joint, for example, if it's a very severe degeneration, you're going to need more stem cells. If it's a mild deterioration, you're not going to need as much. So there's some specifics in terms of the exact amount of dosing. We have a pretty good sense of how much is going to be effective, if it's going to be effective. Because it's an emerging field, there is no set kind of standard guideline to follow.
That makes sense. Now, we talked about pharmaceutical approaches and the fact that there are sometimes potentially very serious side effects. Have there been any side effects noted from stem cell treatment yet?
I'm glad you asked that question. No is the answer.
Okay.
That's why I love it. It's not a cheap treatment by any stretch of the imagination, but there are no downsides to it. There's literally not one recorded downside or side effect from stem cell therapy. After you get it intravenously injected, you might feel a little bit of a hot flush that lasts maybe a minute or two. Obviously, anytime you're sticking a needle into somebody, there's always the potential that you might cause a little infection or a little bit of bleeding or a little bruising. But that's not a side effect from the stem cells. That's a side effect from the needle.
Right.
And so outside of that little hot flush that you might get if you get it intravenously injected, there's no documented ill side effects.
Okay.
Which is just incredible. I mean, how many things can you say that about? Even most herbs, people think of herbs as being really safe, but herbs have side effects too.
Yeah, they can cause reactions.
Anything in the wrong dosage is a poison. And so I love that question because I can say that there's virtually a 0% chance. Now, in theory, is there a chance? Yeah, maybe there's a 0.00001% chance.
I would think that the only chances, well, I shouldn't say the only chances. I would think that some of the chances would depend on what the source of the stem cells was and how thoroughly it was checked or they were checked. Like if it was from another person or if it was from an infant, if they weren't checking to make sure that the mother didn't have something like she wasn't a drug addict, or if she didn't have hepatitis, or, different things like that that could get into the fluid or the cells or something that could be carried over, that there's that potential. We were discussing that last time, is that it's important to make sure that when you are getting stem cell treatment, that the doctor that's doing it, that their source for the stem cells comes from a place that goes through the proper protocols for checking all that stuff.
Absolutely, completely necessary. I mean, we're talking about stem cells, and it's so important to get good quality, and that includes certainly using a blood lab because that's who collects this. It makes sense. It's coming from the umbilical cord. And so using a lab that goes through all of the rigorous guidelines that they should be going through and that is FDA cleared to do what they are doing. And then also so that good clean source, absolutely necessary. And then the other aspect is quality. Quality matters with stem cells because this is an emerging market and there's money to be made in it for those selling any kind of stem cell therapy, which is not necessarily a bad thing, but a lot of people are hopping on board. A lot of companies are hopping on board and probably cutting some corners in terms of quality. And so you want to know as best as possible, as best as science makes possible currently, is how many stem cells are there before being frozen, because that's what happens is once they spin down these stem cells, they get put in liquid nitrogen and are stored there until they're injected or they're shipped on dry ice, and then we store them in liquid nitrogen. And then probably the bigger question is how many of those stem cells, what percentage of those stem cells are still alive when we do thaw them out right before putting them in the person. And that was also part of my research when I wanted to give my mother-in-law stem cells. I wanted only the stuff that was going to give her the best chances. And so I vetted a lot of companies and ended up settling on one. There was another one that I really like, but these two companies, I believe, are head and shoulders above most other companies. And I'm not going to mention the names of them because I might switch companies, because ultimately all I care about is giving my patients and my mother-in-law the best quality. And because this is an emerging field, there might come up a third company that I think is going to offer a better quality product. And ultimately, my job is always to vet these companies so that we can give you the best bang for our buck if we deem stem cell therapy to be appropriate.
Absolutely. So if somebody is going to see somebody, because somebody might listen to this that doesn't live locally and that wants to take advantage of the potential that comes from stem cell therapy, if they go to see a doctor as a potential for doing that, what are the best questions they should ask to make sure that they're going to get the highest quality results, not only from the doctor, but from the stem cells that are being used?
Ask the doctor if they know, where they're getting it from. What blood bank are they actually getting it from? Mm-hmm. Ask them if they have been shown data on the viability, third-party data on the viability of the stem cells after the thaw. That's probably the most important one right there. And has the blood bank been cleared by the FDA? Because if they're cleared by the FDA, you know they have good safety precautions. Mm-hmm. So there's that aspect. And then if they can give you third-party data on the viability, that's the other. Post-thaw viability, that's the other major aspect.
Now, could they also ask the doctor what company he's using and then maybe do their own research on the company?
Oh, absolutely. Okay. I would highly recommend that. More knowledge is always better.
Definitely. Because to be perfectly honest, in any emerging field, a lot of times you have people jump in that are not the most ethical, that are going for the money, that may use sugar water and call it stem cell. And you want to check into things that the doctor, whether they've had any complaints against them by the board, and how long they've been doing it, just to make sure, especially in something that's that involved.
Yes.
Yeah, if it's somebody doing something simple, it's still good to check on. But if somebody's got a serious condition, they're trying to get help, you want to make sure that you're going to get the right kind of help.
Yes. Yes to all of those.
Okay. Now, do you do anything differently here along with your stem cell treatment to make sure that it's going to get the best results possible?
Yeah, I like to think so. I'm huge on overall health of the body. And so if someone wants to come in here and pay us for stem cell therapy and they just want to get it done with, fine, we can do that. But what I would prefer, and what I had my mother-in-law do, was basically go through a detoxification program first. Because what I want her body to be as clean as it possibly can be, so that when we inject those stem cells and growth factors into her body is going to be able to turn around and do the healing that it needs to do. And so we really maximize it as best as we know how. And our protocols will change over the months and years as we learn more and more on how to maximize someone's health, but it's a huge thing. So typically for the average person, we'd love for them to go on maybe a 10-day detox or maybe even a 21-day detox. This is a tall ask, but I'd love to see someone do a 3-day water fast beforehand, if they could tolerate it, or maybe even a 4 or 5-day water fast. There's some literature emerging that suggests that might really prime the body and make it receptive to that stem cell therapy even more, as well as turn on your own stem cells that are already there. Because we all have stem cells. Even the oldest ones of us have stem cells. We just don't have enough oftentimes.
Right.
And then we do add on a few little supplements here and there. And I'm not even going to name names of what we give, because that will also change over time as well.
And it varies from person to person.
And it varies from person to person, exactly. Nobody is the same. And so we don't give one protocol for everyone. We don't have this kind of pre-stem cell protocol that we just stick to. We really individualize it. But I'm a huge fan of priming the body. This is, again, it's what I did for my mother-in-law. We changed things around a lot. And I believe, I have no proof of this, but I believe that made her stem cell therapy that much more effective. And we do have proof that she's stable almost a year later, which is just incredible.
Absolutely. And it makes a lot of sense to approach it that way. I know my brother does when he puts people on diets for weight loss. A lot of times he'll have them do a liver detox before doing that because, of course, the liver is what cleans the body. And if you've got a lot of junk going on in the body, it's going to adversely affect it and make it harder for your body to do any of those things like losing weight or healing itself and so on and so forth. So it's a very smart approach that you have on that. And you use nutrition other than just with stem cell therapy as far as with your patients?
Yes, definitely. I mean, when we're going for optimal health, and that's what we're going for with everyone who walks through the door, there's almost always a nutritional component. Now, some people are way more ahead of the game on that front. Some people are not ahead of the game on that front. So we really meet people where they're at, figure out where they're at, and then work with the person, because that's so important, and work with them wherever they're at from a mental state. Because we can't just give orders. If I just shout off some orders, give people 10 things to do, maybe they'll do a couple of them, maybe they'll do all of them, but how long are they going to do them for? And so I'm really a big fan of individualizing treatment, meeting people where they're at, and really going as far as they want to go on the healing front and teaching them to giving them the tools.
You're correct. Trying to get somebody to do something, if they don't come to the realization themselves that they need to do it, it's going to be like trying to force a kid to go to bed at night when they want to stay up.
Yes, that's a great analogy.
Yes. So the educational aspect of things is quite vital. So that's a very smart way to approach it.
Yeah, and I think doctor in Latin means teacher, if
Correct.
I'm not mistaken.
The root of it, yes.
Yeah, and so that's what I view myself as I'm a teacher for my patients or clients, and the better job I do, the better you or the patient will end up.
Absolutely. Now, I can see how busy you are, so I can imagine you aren't able to accept everyone who wants to see you as a patient. Because of that, you probably look for certain qualities in a prospective patient when you're deciding whether you can help them and whether you should accept them as a patient or not. What are those types of things that you need to see in a patient to make sure that you're not going to be wasting your time or their time by having them come in here?
Number one, a committed person, someone who's really committed to their health.
Mm-hmm.
You know, there's plenty of other doctors who people can go to for this prescription or that prescription. If they just want to hop on something for their depression, go to some other doctor, because there's plenty of doctors, good-hearted doctors who can do that for you.
Mm-hmm.
So I'm really looking for people who want to be helped. That's the only thing. If they want to be helped, then we can work together.
Well, there's that aspect of it, but there's another aspect too, which is that they're willing to be responsible for their results. Because you mentioned before about somebody who's going to just come in and they want you to just do X, Y, and Z. You won't get the best results if they think you're going to make the change in them if they're not willing to make changes themselves.
Totally true. I mean, I still have patients who have been with me a long time, well, a lot of patients who have been with me since 2011, but some of them are so into and so proactive and willing to be open and willing to learn and willing to try new things. And we can learn together. You know, this is life. So you're never, even if you hit kind of what you think optimal health is going to be, at some point, you're probably going to take a step back and you're going to need a little bit more help. And then I have some patients who just, they put in minimal amounts of effort, and, you know, and that's where they're at. And I can't force the kid to go to sleep necessarily. And I can't force people to do certain things. And so you are correct. I'm looking for people to be committed, but also to be open to that process.
Excellent. Now, if somebody would like to learn more about you or your clinic or the services that you offer, where can they get that info?
Yeah, check us out, dryoshi.com. That's DR for doctor, and then my first name, Yoshi, YOSHI.com. So dryoshi.com. It's probably the best one. I also have another website, naturalkneetherapy.com, mainly for the prolozone and PRP and stem cells for joints. But most of our good info is on dryoshi.com. So you can even sign up for a free 21-day email that I put together. And it's just me sitting there. I give you a couple minutes of just honest, good health suggestions.
Mm-hmm.
And the way I frame it is I'd love for every new patient or to go through and start doing those, or at least be familiar with those before ever coming to us. Because I think the 21 items can get the majority of people a majority better. And so if I can keep you from even needing to come see us, fantastic. Then I've served you and I've served other people. And that really does warm my heart. So feel free to go on there, sign up for that.
Good. Well, I'll put the links for those in the podcast notes. And if somebody'd like to schedule an appointment for consultation or get questions answered, what number should they call? What are your office hours and where is your office located?
Office phone number is 818-957-6909. Again, 818-957-6909. And our office hours are 8 to 5, Monday through Friday. And we are located in North Glendale, 1 block away from Montrose
On
Ocean View Boulevard.
Excellent. Is there anything else you'd like to say before we end?
No, thank you. And again, thank you to everyone who is listening to this or who will be listening to this. Thank you for investing your own time into this. And thank you very much for having me on.
You're very welcome. This was wonderful information. Now, before I leave, I just want to take a moment to thank all of you who joined us this week. I really do appreciate the time you take to listen to this podcast, and I thoroughly enjoy getting to introduce you to all the special people who agree to have a conversation with me. I hope today's guest shared some information that'll help you or someone you care about, and I'll continue to do my best to bring you interesting local guests with useful advice. If you have any suggestions for a guest, please email me at ron@eastglendale.com. That's ron@eastglendale.com. There are 3 things you can do to help me be able to continue to bring you interviews like this one. 1, listen to my other podcast episodes that cover topics of interest to you. 2, spread the word and share this podcast with others. And 3, subscribe to the podcast. To automatically receive each new podcast episode as it comes out, make sure you subscribe on iTunes, Stitcher, or Google Play so you can continue on this journey with me. In fact, go ahead and do that right now so you don't forget. And if you want to leave a rating or review on iTunes or Google Play, or send me an email, I'd love that too. See you next week.